Hello, my name is Allyson Rupp, and I'm the social worker for the Adult Pulmonary Hypertension Service here at Stanford Healthcare. Today, I'm going to talk to you about receiving a diagnosis of pulmonary hypertension, or PH, the ways to adjust, cope, and continue living after being diagnosed. A PH diagnosis can strike anyone at any time, and no one can be prepared immediately to handle all aspects of such a difficult condition. Learning that you have pulmonary hypertension can turn your whole world upside down. All new patients, when learning that they have PH, respond differently. Some may feel angry, frightened, or lonely. Others may be frustrated, worried, numb, or some combination of those feelings. It's important to remember that there are no right or wrong reactions. Give yourself some space and ask others for some, and time to feel and process the diagnosis so that you can begin to move forward. Having PH can disrupt your life, forcing you to put goals and dreams on hold, and changing how you think about yourself and identify with the world around you. Initially, learning that you have a chronic illness can be profoundly painful. Whatever losses you may face, it's normal to need time to come to terms with them and what they mean to you. For many patients, this process is similar to the grieving process one experiences when a loved one dies. Instead of grieving for the loss of a person, a PH patient may grieve for a part of his or her identity that feels lost, for a body that does not feel trustworthy, or for the ability to be spontaneous, or what could have been. Feelings of loss can be frightening and overwhelming, and many people who are diagnosed with PH struggle to find balance and security when diagnosed. There are definitely things that everyone can do to minimize the impact of distress, isolation, and varying emotional responses that come along with this diagnosis. Recognize that being upset, sad, frightened, angry, disappointed, numb, or other emotions are usually normal, expected responses to rather abnormal and unexpected news. How you approach these feelings influences your overall experience and adjustment. Be aware and identify your own signs of depression, including prolonged periods of sadness, frequent tearfulness, poor motivation, lack of interest in activities you typically enjoy, changes in sleep, like sleeping more or less than normal, and appetite changes. Discuss any of these issues with your clinical team, your primary care physician, and/or a mental health provider. There may be medications for controlling symptoms. Seeing a therapist, psychologist, or a counselor is a constructive way to talk about how you feel and learn how you reduce the impact of these feelings on how you function and enjoy your life. Seek immediate help if you find yourself feeling hopeless and wanting to harm yourself or others. Your local emergency room or emergency medical services can help get you the help that you need quickly. Locate a support group or a peer mentor, someone else who has PH, in your community or through your PH center and participate. Peer support is a valuable resource that demonstrates that you are not alone. Others with PH may have similar experiences, feelings, and triumphs with PH. They may have strategies you haven't tried, perspective that is helpful, and friendships that you will cherish. You may have important strengths to share with others as well, and your reaching out to others can renew confidence in yourself and remind you that you can get through challenging circumstances. Prepare all that you can. Having an illness like PH is unpredictable. One can regain control over some aspects of life by taking charge of things that can be controlled. Talk to trusted loved ones about your wishes and values so that they can speak on your behalf and handle affairs if you become hospitalized or are incapacitated at any time. Completing an advance directive and appointing a surrogate decision maker is a necessary task for everyone, sick or not, to ensure your wishes are known in a medical crisis. Think about telling a trustworthy friend or family member where important papers are kept so that they can be accessed if you're away from home for an extended period of time. Develop a plan to have stable finances available. For instance, complete disability paperwork, talk to your employer about medical leave benefits, and research what you need to do to sustain medical insurance. If you have the fortune of being able to plan for a hospital stay or a change in therapy that might knock you off your feet for a while, pay bills in advance or recruit a friend to take on imperative tasks for you. Try to arrange pet and childcare providers and pack a bag with creature comforts. Planning for predictable things can minimize the stress of a hospital crisis and help you focus on your energies to maximize your health, adjust to new medications, and learn what you need to do to adjust. Explore new hobbies. Maybe your disease has hindered your ability to participate in active tasks you once enjoyed, but perhaps there are tasks on your bucket list that are less physically demanding. You can adopt new hobbies with a flavor of the old. For instance, if you played baseball, try to coach a team. If you enjoyed running, enroll in a charity run or walk and do the walking part, and fundraise for a cause, or volunteer at the events. If you're missing social aspects and networking associated with your work, explore how you can serve on an advisory board or a planning committee related to your profession. Or discover new interests and passions in your community, book clubs, sewing groups, advocacy groups, community organizations, or your children's school functions. As important as it is to have peers who know how it is to have a chronic illness, it is equally helpful to have friends and contacts who are unrelated to the PH community. Some people may find themselves immersed in an environment where PH is all they have spoken about, and taking a break to discuss and do un-PH things will help you to find some balance and normalcy. Maintain a routine. It's very common to fall victim to boredom and depression when the routines that you are used to are no longer available. If you've been unable to work due to disability, finding a routine can be a challenge, but research shows that maintaining consistent sleep-wake cycles and remaining involved in a regimen can uplift spirits, reduce depression and anxiety, and maintain general health. Try to wake up and get moving at the same time every day. If you don't have plans outside of the house, get up and get dressed anyway. Make a list at the start of each week of things that need to be done and tackle a different one each day. Have a friend or a relative join you for a daily or a weekly date, something that you can look forward to and enjoy. There are so many avenues for coping, and these only detail a few. Be sure to involve your treatment team in discussion of how you are doing, and seek input and suggestions where you are struggling. Remember, your social worker may have a bundle of ideas that can help you activate your resources to help in a crisis or just the day-to-day. Don't hesitate to ask for help when you need it. This is a lifelong endeavor, and you'll need to pace yourself and try to remain flexible to ever-changing needs. Coping and healing in the months and years after diagnosis can be a long and difficult journey, but by tending to your physical, social, mental, emotional, and spiritual needs, you'll be able to rediscover a life worth living.